Hello, and welcome to this presentation, where we'll investigate the impact of student-centred workshop approach being used within nursing education within the United Kingdom. My name is James Oram, and I'm a senior lecturer at Swansea University in Wales. Nursing education faces a challenge today. There is an ever-evolving healthcare landscape which requires nurses to operate in very fast-paced environments. And the traditional didactic methods of teaching may hinder student engagement and indeed their critical thinking, leading to student disengagement. To respond to this, I wanted to investigate the use of workshop methodology as a new approach to delivering core content within a module of nursing education. To foster small group work, to encourage collaborative learning, develop problem-solving approaches and enhance critical thinking, utilising methodologies like discussions, debates and use of video materials, including role play and clinical simulations, to develop student engagement with their own learning. For this small-scale study, we looked at developing the workshop methodology approach within a single module in the second year of a nurse's education. This is a 9-week programme and was taught to 52 undergraduate nursing students. They had 133 hours of taught face-to-face content delivery, and 100 hours of that involved using this workshop methodology. The students also had time for self-directed learning and independent study, along with development and preparation for formative and summative assessment. Within this study, we needed to evaluate the methodology from the student's perspective to identify if workshop methodology actually developed students' learning and understanding. We engaged 52 students who were engaged in the programme. 46 actually completed the evaluation. We completed a survey evaluation of 15 questions following a Likert scoring system for 12 questions, but also an additional 3 questions to elucidate qualitative data. The analysis was both qualitative and thematic. Our survey focused on 5 key areas. Was there clarity and understanding of the learning objectives? Did the students have an understanding and practical application of the learning materials? Were they engaged and active participants in the programme? Were they self-reporting that their assessments had improved because of this methodology? And did the learning environment support the students and encourage them to engage and ask questions in relation to the module learning? So what did our survey reveal? Well, when we looked at the qualitative results, we found that 4 out of 5 students had found that they had engaged with the learning materials. They'd enhanced their knowledge, understanding, and critical thinking skills. The learning outcomes had clearly been met. More importantly, over 4 out of 5 students self-reported better results being obtained at the summative assessment because of the methodology used, and that they found that the learning environment of the workshop and the methods used encouraged them to develop their understanding of the learning materials and application to future practice. So what did the students tell us that they actually enjoyed? Well, they very clearly enjoyed the interactive discussions to develop that meaningful dialogue. They understood and were able to participate in role play activities to develop understanding and confidence in nursing care. They were able to develop their practical applications, but also develop these within a supportive learning environment. Of course, there are always room for improvement. And the students were highlighting content repetition as one area of concern. Maybe utilising a more streamlined approach with clear progression could optimise learning in the future. The students also highlighted that they would like more clinical scenarios within the module. And indeed, if we could incorporate more diverse patient scenarios, more complex decision-making exercises, and do that with the collaboration of other disciplines, highlighting the students' need for interprofessional learning, we could deliver a more effective module. Students also felt that some of the workshops were rushed and that sessions could benefit from additional time allocation, and that is something we will certainly place into practice with future runs of this module. It was clear from our survey evaluation that there were some key benefits from utilising workshop methodologies, and enhanced engagement with learning was definitely top of the students' list. They highlighted that their active participation within a supportive environment developed their understanding and application of knowledge and critical thinking. Students self-reported higher engagement with group discussions, practical activities, including role play. They also found that the workshop methodology created a safe place for learning and indeed for the students to ask questions. They reported that the lecturers were approachable and encouraged participation, that the methodology enhanced peer development and support and reduced anxiety when they needed to ask questions. Students highlighted another key benefit of the methodology used was the development of a deeper understanding of fundamental concepts of nursing, so a deeper comprehension. The students had better knowledge retention and application to theory and practice, and that they'd enhance their abilities to use critical thinking to help them analyse complex healthcare situations in practice. A further key benefit was the self-reported assessment performance. Of the students who undertook the survey, 100% pass rate for this module was obtained. Overall, students reported that their self-reported impact of the workshop led to a better grade at the end of the module. In fact, all students within this particular module for this assessment obtained a classification of 2-1. So there are implications of utilising methodology relating to workshops in nursing education. Myself, I can highlight the fact that there needs to be a shift from passive through to active learning, moving beyond traditional lectures to encourage engagement. This will help us develop future-ready nurses that can develop and adapt in complex healthcare situations. Workshop methodology does create a supportive environment and can help students to understand and bridge the theory to practice gap. So what are the conclusions and next steps? Well, we have found that this workshop methodology has proven to significantly enhance our students' self-reported understanding, learning and development in practice. We hope to incorporate their feedback for further runs of this module, address the time management and content concerns. We hope to engage in ongoing qualitative research relating to the use of this methodology and expand its use in interprofessional learning. I'd like to thank you for listening to today's presentation, and I hope that I've stimulated your enthusiasm for education innovation and certainly the use of workshop methodology, which I fervently believe will enhance future development of further education and higher education courses, especially in healthcare practice. And I hope you enjoy the remainder of this conference. Thank you.